Hello, everyone. My name is Kelly Sharda. I am an RN BSN student at Indiana State University. Today we are going to discuss diabetes among Hispanic adults. During this presentation, instruction will be provided in English as well as in Spanish. There is an increased risk of developing diabetes among the Hispanic population as well as complications of diabetes. Understanding diabetes, how to prevent, manage with cultural awareness is vital for the Hispanic population to become successful with diabetic treatment. Here is what you'll learn in this presentation. Our learning objectives for today are: explain 2 risk factors for diabetes. Describe the best times to test blood sugar levels at home. Name 3 complications of uncontrolled diabetes type 2. Describe 3 ways for a family to participate in managing diabetes type 2. And understand which foods are best to eat on a diabetic diet. So who is at risk? Our PAR, or population at risk, are Hispanic adults ages 18 to 64. You can now pause this presentation and take the pretest in the link provided. Use the pretest to test your knowledge to see what you already know about diabetes and how it affects the Hispanic population. So what is diabetes type 2? Diabetes type 2 is a condition with elevated blood sugar levels in the blood in which the body does not make enough insulin or does not utilize insulin well. Insulin is needed to transport sugar, or glucose, into the cells. When the body does not have sufficient insulin or unused insulin, glucose remains circulating in the blood, causing high sugar levels. Why are the Hispanic population at a higher risk for developing diabetes? One reason is genetics. According to the CDC, genetics play an important role in the prevalence of diabetes. However, the reason or the cause is not understood. Another reason is food. Many Hispanic and Latino foods are high in fat and high in calories. In the Hispanic culture, many family celebrations revolve around food and eating together. Refusing to eat at a family gathering could be offensive, so many feel expected or pressured to eat at a family gathering. Another reason is weight and activity levels. Obesity is prevalent in the Hispanic culture. Often larger sizes are considered healthier individuals. The Hispanic culture often are not as active. There are several risk factors for diabetes type 2. One factor is obesity. A high BMI in the overweight range puts you at higher risk for developing diabetes. Age. Over the age of 45 is considered a risk factor for diabetes. Ethnicity. Hispanic Latino Americans, African Americans, Native Americans, and Alaskan Natives have a higher prevalence of diabetes. Less active. Those who are less active or exercise less than 3 times per week are at an increased risk for developing diabetes type 2. Family. If you have a family member or more with diabetes, you are at a greater risk yourself for developing diabetes. Another risk factor is developing gestational diabetes. If you have gestational diabetes during pregnancy or have a baby over 9 pounds, you are at a greater risk for developing diabetes. And lastly, Prediabetes. If you are considered pre-diabetic with elevated blood glucose levels, you are already at a higher risk for developing diabetes. Complications of diabetes type 2. Diabetes affects many health systems within the body. Diabetes affects the heart. Heart disease. Diabetes can cause high blood pressure and high cholesterol levels due to the damage done to the vessels from high glucose levels. Kidney damage. Vessel damage from high glucose levels affect the kidneys and the filtration abilities. Nerve damage. High glucose levels cause neuropathy within the body. Vision loss. Diabetes can cause retinopathy, which can lead to blindness. Foot health. Nerve damage can cause inability to feel pain from blisters or wounds on the feet. And lastly, hearing loss. Damage to the blood vessels in the ear can lead to hearing loss. So how can we manage diabetes? First, testing your blood sugar. Monitoring blood glucose levels helps to determine the treatment regimen for managing diabetes. When to test your blood sugar depends on your treatment regimen. Fasting glucose levels are common. To test for a fasting glucose level, test your blood sugar after waking before eating and drinking anything. The target range for fasting glucose levels are 80 to 130. Additional times of when you should check your blood glucose levels. Of course, fasting in the morning, before mealtime, 2 hours after a meal, and also at bedtime. Mindful eating. Mealtime is a time to make lifestyle changes to help manage diabetes. Choosing good foods such as lean proteins, non-starchy vegetables, and drinking low-calorie drinks helps to maintain low glucose levels. It is important to make sure that you eat at regular intervals and do not skip meals. Limiting sweets and alcohol, and also consider your portion sizes. Another way to manage diabetes is to get plenty of exercise and physical activity. Walking or hiking, running, or biking are ways that you can get physical exercise. Try involving the whole family in activities to get everyone moving. Work together. Family. Family is critical in the Hispanic culture. Family involvement in meal preparation, healthy food choices, establishes family lifestyle changes. This helps to decrease risk factors among children and teenagers. Families can have fun together, performing physical activities which will teach younger ones how to decrease their risk factors for diabetes. For more information, visit the links below. At this point, you can stop the presentation and complete the post-test in the link provided. This will help you to understand the learning objectives that we had set at the beginning. Here are a list of references that I used to make this presentation.